Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. AstraZeneca vaccines arrive Abuja International Airport. Nigeria becomes the third country in Africa to receive the COVAX facility. And we'll bring you the reaction of frontline workers who are first in line to receive it. Plus, Indian High Commissioner to Nigeria confident of vaccine efficacy, hints that many more doses are expected. Total samples tested has passed the 1.5 million mark in Nigeria, just as the country continues to record minimal cases of the coronavirus in the country. Just last night, the 1st of March 2021, 360 new confirmed cases and 8 deaths were recorded. The 360 new cases are reported from 19 states, with Lagos leading 120 cases, followed by Edo 38, Kaduna 25, the FCT as well. Imo recorded the same 23 cases, Delta 19, Akwa Ibom 17, Plateau 17 as well. Rivers recorded some cases, Nasarawa, Kwara, Oyo, and the rest of the states you can see there on your screen. Till date, 156,017 cases have been confirmed. Those that have been discharged are over 133, while the deaths recorded in the 36 states and the Federal Capital Territory stands at 1,915. And it's 386 days after Nigeria detected her first case. The first batch of the Oxford AstraZeneca vaccines has arrived the country. And this is via an Emirates airline flight earlier today at the Nnamdi Azikiwe International Airport. Chairman of the Presidential Task Force on COVID-19, the Ministers of Health, Information, among others, of the federal government delegation, including the Executive Director, Chief Executive Officer of the National Primary Healthcare Development Agency in charge of the vaccination campaign, were all on ground to receive them. So now Nigeria has become the third country in West Africa after Ghana and Côte d'Ivoire to receive the shipment of the AstraZeneca vaccine from COVAX facility. Now, the receipt of 3.924 million doses of the vaccine breathes some hope into the country's journey to herd immunity against the coronavirus pandemic. Let's take a look at perhaps some of the schedule of activities as indeed the vaccine rollout kicks off. So March the 1st, we were told that Nigeria is scheduled to take delivery of the doses. And fast forward to today, March the 2nd, the first batch has indeed arrived, 3.29 million. Now, in the next few days, the 3rd of March and the 4th, a few vials of the vaccines are expected to be handed over to the NAFDAC team to analyze over a period of 2 days. And then on the 5th of March, inoculation day for frontline health workers. We understand that after clearance by NAFDAC, the PTF, the Ministry of Health, the National Primary Healthcare Development Agency and strategic leaders, that they will be at the National Hospital on Friday where this will be carried out. Now, March the 8th, more vaccination sites would have been set up, designated locations such as the National Assembly Clinic, State House Clinic, the Federal Medical Center, Jabi, where strategic leaders like the SGF, President of Senate, Speaker of the House, the IGP, a few ministers, senators, traditional rulers and religious leaders are expected to be vaccinated. And they also talked about the rollout in phases. The first phase, phase 1, is, of course, the vaccination process, which will begin after the initial rollout. The second phase involves the vaccination of the elderly from 50 and above, and they have been subgrouped into 2. The vaccination of those who are 60 years and above first, followed by 50 to 59 years across the 36 states and the FCT. Those eligible for vaccination will have to register electronically as well, while those who are elderly will be assisted to register at the designated health facility. Phase 3 of the vaccination process involves the vaccination of those between 18 to 49 years with comorbidities. And then phase 4, the vaccination involves vaccinating the rest of the eligible population. And then we also understand that pregnant women will be evaluated by their health providers to weigh the benefits versus the risks before a decision is taken to vaccinate them. More information about the AstraZeneca vaccine is the recommended dosage of 2 doses given, and this is the interval of 8 to 12 weeks. We also understand that longer dose intervals within the period range are also associated with greater vaccine efficacy.
This is really the moment that we've been waiting for. 4 million doses of the AstraZeneca vaccine. From what we've heard from the Serum Institute of India and the Indian High Commissioner, this is one of the largest consignments of vaccines that has been delivered to any country globally. Just like we've communicated over the last few weeks, these vaccines are going to be coming in batches. From the COVAX facility, we expect 16 million doses of these vaccines between now and the month of May. This is the first batch of the 4 million. So in the course of the next few months, we expect additional doses. Do not forget that apart from the COVAX facility, we are also expecting vaccines from the African Union through the AVAT platform. We're expecting some 41 million doses of vaccines from the African Union, made up to 22.9 million doses of AstraZeneca and about 18.4 million doses of the Johnson & Johnson.
For more on the vaccines arrivals, joining us from our Abuja studio is Professor Innocent Ujja, is the president of the Nigerian Medical Association, NMA. Thank you for joining us. We also have the National Incident Manager of the Presidential Task Force on COVID-19, Dr. Mukhtar Mohammed. Thank you both for joining us at this time.
Thank you very much, and good evening.
I'd like to begin my question from you, Dr. Mohammed, and this is many were wondering indeed when the doses, the vaccines would get here. Briefly talk us through the journey as to how we got to today.
Thank you very much for having me on this program. Good evening, viewers. Actually, this has been a very long journey. The PTF, in collaboration with the Federal Ministry of Health, as well as the National Primary Healthcare Development Agency, have been engaging with the global bodies, particularly the WHO, Gavi Alliance, and CEPI, to try to see how, in the midst of this rush to vaccines, that Nigeria is able to secure our fair share of this vaccine. There have been several discussions and negotiation in terms of the quantity, in terms of the order, which country gets its own first. And there has been a lot of pressure from our political leaders to ensure that Nigeria is not shortchanged in this process. We also how it played out in terms of the pressure on the manufacturing companies. We saw how they have shifted dates in terms of the quantities they promised to produce. And we saw how some other countries have grabbed these vaccines beyond what their population, just trying to ensure the safety of their own citizens. All this has delayed, our effort to ensure that we have these vaccines as soon as possible in the country. But today is a very remarkable day, and we are very grateful that at least this part of the promise from the COVAX facility has now been fulfilled. We have about 4 million doses in the country, and this is going to be rolled out as soon as possible. So it has been a really remarkable journey, but at last it is fulfilling that these quantities of vaccines have started to arrive now.
All right, let's go over to Professor Ujja. I mean, it's been called the beginning of an end to a pandemic. Are you excited that we are now one step closer to controlling the pandemic?
Well, let me say that we are very delighted that this is a positive contribution to the national response on COVID-19. And it is my delight that the federal government has kept to its promise of giving us vaccines. As far as the end of pandemic is concerned, it's very difficult to say. It's too early to say. Now that we have got the vaccines and many more will come in, what will play out as a success is the way and manner these vaccines are being used and distributed, so that many of our people have access. I'm happy to say that, to note that those who are at the front line, there's the doctors and other health workers at the front line, will receive the vaccines first, and then it goes to those who are 60 and above, and then, of course, those who have comorbidities of hypertension, diabetes, cardiac disease, and renal conditions, so that we reduce the morbidity and mortality as that are associated with COVID-19. So it's a good step, and we want to say that the government has kept its promise, and we should not relent. This is just the beginning. That should not prevent us from observing the NCDC protocol of regular hand washing and use of sanitizers, face mask use, and social distancing. Because we do not know the biology, clearly we do not know the biology of COVID-19. And we do everything to ensure that we protect our people from this dreaded virus. So I would say that today is a good day because the government of Nigeria has kept to its promise. And we pray that everybody will cooperate with the process, the NPHCDA, the Federal Ministry of Health, the PTF, and the service providers who are in the field should continue to give their support and render their services to ensure that our people are better placed so that we stay safe from the dreaded virus. Thank you.
Just before we hear from Dr. Mohammed on some of what you've mentioned, I'd like to ask about vaccine hesitancy. Members of the NMA, are they willing to take the shots of AstraZeneca vaccine?
Yes, of course. As you know, as doctors, we work based on science, and science has proven that this is effective. Let me just say clearly that there's no vaccine that is 100% safe. We are looking at the untoward effects or side effects. So individuals have their own idiosyncrasies, but that will not prevent doctors from taking the vaccines. Anything that will keep us safe, we will embark on. And if it's been taken by other countries, and even among the blacks in the US, I think that we would participate fully in this process, because it was not easy to get the vaccine to begin with. It was competitive, and we're happy that Nigeria has been part of the first few. We are told that we're the third country in Africa, and that is good. 1, 2, 3. First 3, by any standard, is good enough. And I would want us to cooperate. My colleagues and other health workers should cooperate with the government and the NPHCDA, so that the process of the vaccination will be seamless. If that is done, then of course we will achieve, and of course I must say that in doing so we must document, because that is where we fall inadequate. We rush to it, and without proper documentation, we will not be able to say this is what. Even the follow-up, those who we give must follow them up, to look at those who probably will have one untoward effect or the other, for documentation. Because not only that we need to know this, we also publish this, so that in the end, the international community will know what Nigeria has contributed to the body of knowledge in the use of vaccine.
Thank you, Prof. Let's hear from Dr. Mohammed now. And this is on some of the challenges Professor Ujja has mentioned: distribution, logistic issues, and all of those preparations, ensuring that it really gets to the people it's meant for.
Yeah, certainly. As far as the preparations are concerned, we have been briefed adequately at the PTF by the Federal Ministry of Health as well as by the National Primary Healthcare Development Agency. We are confident that the preparations have been quite adequate. Cold storage facilities have been assessed, and we have enough capacity to store these vaccines and also to store even more consignments that are to come. Health workers have been prepared. Trainings have been going on at various levels. In Abuja here at the federal level, they have done the state trainings. They have cascaded down to training the people in the primary healthcare facilities who will be administering these vaccines. It is an elaborate plan, and everything for now is going on in accordance with the plan. This is not to say that we may not have some small hitches in terms of logistics or in terms of deployment of people to the field when necessary. But it is also pleasing to understand that we have backup plans, arrangements to be made in case there is delay in terms of delivery of these vaccines, and in terms of shortage, in terms of number of people registered to be able to move vaccine from one point to another. You will recall that people are, the website or the link has been sent out where people can now register and get themselves ready for the vaccine. So this link is available and people are already registering. We know that there may be some technical hitches, particularly with the IT part. People should not panic and people should not run to conclusion that this is not going to work. We know that every IT system has challenge. And imagine when you have about hundreds of thousands of people trying to register at the same time. So sometimes it can freeze. You can have some small glitches, but these are all being fixed
all right, Doctor.
So just to reassure Nigerians that all the logistics arrangements are being put in place, and we are ready to commence the vaccination.
We'd like to thank you. We'd like to thank you both, and congratulations. The first step to controlling the pandemic. We would like to thank the National Incident Manager, the Presidential Task Force on COVID-19, Dr. Mukhtar Mohammed, and Professor Innocent Ujja, President of the NMA. Thank you for talking to us.
Thank you.
Still to come, we speak to the National Association of Resident Doctors on the vaccine's arrival. We'll also have more stories. Now, earlier today, our correspondent, Gloria Mizuke, spoke with the Indian High Commissioner to Nigeria, Abhay Thakur, who says the vaccine was approved by NAFDAC and the PTF, and Nigeria is one of the first African countries to receive the Oxford AstraZeneca brand.
This is the first vaccine approved by Nigeria, by NAFDAC, for emergency use authorization, the COVID-19 vaccine. Under AstraZeneca license, manufactured by Serum Institute of India in Pune, the world's largest vaccine manufacturer. We are confident. We have so far supplied more than 36 million vaccine doses to nearly 36 countries. We are looking forward to supplying to at least 15 more. Nigeria is one of the first few countries in Africa to receive this. We have seen excellent results of both the Covishield vaccine as well as the second authorized vaccine in India, Covaxin. And we are confident that this will have excellent results as they have had in the rest of the world. We have also looked at and been informed about the initial priorities being drawn up by the PTF. Nigeria being Africa's largest democracy, India being the world's largest, by the way, has very robust systems for reaching the fruits of economic growth, of social growth, of health sector benefits to large sections of its needy population. I am confident that in partnership with the government of Nigeria, the vaccines made in India will reach all those who are in need and boost Nigerian health and economic growth.
Well, Dr. Uyilawa Okoye Suyi, President, National Association of Resident Doctors, NAD, joins us now from our Abuja studios. Good evening and welcome to the program.
Good evening, Millicent. Nice to be on the program.
All right. What's your reaction to the vaccine's arrival? I mean, especially as a frontline worker, seeing how the virus has indeed affected a lot of frontliners in the fight?
We are so delighted that the vaccine is already in Nigeria now. As a frontline worker and president of Nigerian Resident Doctors, I can tell you that we have had over 3,640 residents that have been exposed, with about 17 people that died. And the news of the vaccine being in Nigeria is one thing we are delighted in, and we wish that the government takes all frontline workers into consideration when giving these vaccines to everybody. Thank you very much.
Is there any vaccine hesitancy by members? And there's also been the question as to what happens if there is an allergic reaction to someone who's administered the vaccine.
Thank you. In most vaccines that have been used all over the world, but they are not 100% that without any complications. But however, we know that it's scientifically based, and we know that the reactions that from the in taking of the vaccine could be from mild fever to Horner's disease. And those are reactions that are mild, and there are very few recorded, even in journals as we speak. And there are things that we can always cope with. And I know for us as frontline health workers and members of Nigerian Resident Doctors, we want to take the vaccine because of other people all over the world. There are doctors that have taken it, nurses, and virtually health workers. And it's a welcome development for us. It's a way to tell us that we are doing the right thing. And I must commend the PTF and Nigerian government for laying this to bear, that they have been able to provide this vaccine for us. Also, you know that most of us have been exposed, mostly those that in the accident and emergencies, the nurses, the doctors there. And them being the front health workers must be considered when giving these vaccines, but to help to encourage them to do more and help us to have better results in what we do. Complications may come, but there are complications that have been written down and complications that we can cope with. Thank you very much.
What can you tell us about distribution plans among members of your association, for example, and are you satisfied with them? If you were to advise in terms of transportation, what would it be? The preservation and handling of the vaccine before it gets to even the remotest parts of areas?
I must commend the National Primary Health Care Development. They have done a good job. We have been in contact with them since. We have gone through seminars, and they have been able to tell us on their distribution channels on how to get these vaccines to every person in Nigeria. And I must tell you that they have a good roadmap and have had a good plan on the distribution. And I hope they will be consistent in following out their plans to get all Nigerians vaccinated. Thank you very much.
All right, we appreciate your time. Thank you so much. Dr. Uyilawa Okaisui, President of NARD, National Association of Resident Doctors. Thank you for joining us on the program.
Thank you very much.
The French government says older people with pre-existing conditions can now get AstraZeneca's COVID-19 vaccine, revising its stance on the issue. Last month, France approved the use of the vaccine for under 65s only, citing lack of data for older people. Since then, studies have shown the jab is highly effective among the elderly. Here's more on this and other stories in our global update.
When the AstraZeneca vaccine was approved for use by European Union regulators, France mandated it would only go to eligible people under the age of 65 because data from trials in older age groups was limited. But on Monday, March the 1st, France's Health Minister Olivier Véran says people in the country aged over 65 with existing health problems can be given the AstraZeneca COVID-19 vaccine.
The National Health Authority has decided that henceforth from today, all the vaccines available in France, the AstraZeneca, Pfizer, and the Moderna, have an effectiveness that qualifies as impressive and protects people from serious forms of COVID.
France will also retain its current measures aimed at curbing the COVID-19 pandemic, including a nighttime curfew, as a bare minimum for the next 4 to 6 weeks. In Asia, The Armed Forces of the Philippines launched its COVID-19 inoculation drive on Tuesday, a day after healthcare workers received China's Sinovac COVID-19 doses. Philippine military personnel are required to get vaccinated and may face disciplinary actions if they refuse.
To this symbolic vaccination, one of the COVID vaccines, the Sinovac, and the vaccination rollout across the country, we are now finally taking a historic step towards conquering this pandemic.
The country has recorded 12,369 deaths from the virus and 580,442 total reported cases, including infections with the more infectious UK variant.
Let's not forget that the vaccines are still a drop in the ocean at the moment, so let's continue to take responsibility. You can visit our website, it's channelstv.com, for more updates, a better understanding of the pandemic. You can find other stories as well, politics, business and sports at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.